I'm particularly interested in the loss of childcare that occurred with the pandemic, but more generally, the lack of available high quality childcare throughout the world, and the fact that this hasn't been a priority in the Western world. And I just want to know what you think about that. How can we help countries realize the value of early childhood intervention in the form of childcare?
I think there have to be multiple arguments that we need to make. I think the evidence is pretty strong and consistent about the returns on investment in early childhood. And that evidence we've had for a number of years. Where we lack evidence is firstly in the how to do it. So the how do we invest in implementation research that can guide countries on the best strategies that are culturally informed and that work within the existing systems to deliver these interventions at scale. The second is that we need much more data on the economic returns of these investments. Very few of these interventions that have been proven to be effective have had any costing evaluation attached to them. And finally, I think we also need to put greater emphasis on terms of not just returns to children, but theoretically, while we talk about the returns to society, I think putting an emphasis on issues such as strong early childhood care allows for caregivers to participate in the workforce, particularly female caregivers, is beneficial for communities, is beneficial for society. So I think we need to strengthen the range of the arguments and the data that informs those arguments in a much more targeted way than we have to date.
I have a question, if I may. Thank you so much, Professor Yousafzai, for your paper, and I'm so grateful to you. I think it's 3 o'clock in the morning in Cambridge, Massachusetts, and you were both lucid and very, very moving in your presentation. I wonder if you could comment on the following. 150 years ago, as he was developing the notebooks on what would eventually become the origin of the species, in the margin, Darwin wrote, "Educate women, multiplication sign, number 2, twice the impact." I wonder if you could comment on research on matters relating to the gender impacts of COVID-19 in early childhood care, and what are the data suggesting? And furthermore, what are your recommendations for better understanding the differential investments in that are gendered based? Thank you.
Thank you. I think that's a significant question for a couple of different reasons. First of all, I think this is an area where we haven't disaggregated data, where we've had the opportunity to look at differential impacts of early childhood interventions between girls and boys, for example. And this is something that we need to prioritize. The limited population level data suggests that the outcomes of that child development at the moment is there's not significant differences between girls and boys, but there is a small female advantage in terms of social emotional development. I think more significantly, we actually need to address the gender inequities with relation to care, both in terms of how we think about the well-being of caregivers, particularly maternal caregivers, whether our interventions actually increase the burden of time that caregivers have to give for young children, and whether that is obviously more inequitable in terms of female caregivers, how we're addressing basic issues such as maternal mental health, both during pregnancy and postpartum. I mean, these numbers are particularly high, and often in the mental health community, we think about the missing M in primary healthcare services, which is referring to mental health. And finally, we know that by and large, the early childhood workforce is largely female-driven, whether you think about frontline home visitors, preschool teachers, childcare workers, nurses. And these sectors have been poorly paid in whichever country you're looking at, whether it's a high-income setting or a low-income setting. There has been little to no investment in professional development and training support and career pathways. So I think we need to look at these systems level questions to address how do we strengthen the systems for young children that are more gender equitable. So I think there are 3 levels where we need to think about the differential impacts of early interventions on girls and boys, how we support their caregivers. Another factor that's related to that is very few countries have adequate parental leave, for example, that's implemented. And thirdly, we need to look at the gender inequalities in the systems that serve young children. We know that one of the biggest protection factors for a host of outcomes across the life course is maternal education. And yet, very few interventions really think about maternal empowerment and her economic empowerment. Thank you.
Thank you very much.